Hello, my name is Professor Alexander Röth, hematologist from Essen. In the first clip, you already learned about what PNH is and how it develops. Now, we will talk about the complaints and symptoms of PNH. How do they appear and why they can be so different? PNH affects every person differently. Some hardly feel anything, while others are severely limited. There isn't just one typical symptom that always shows up. And that's what it makes this disease so hard to detect early. One of the most common symptoms is severe debilitating fatigue. It affects up to 80% of the patients with PNH. Fatigue is not the same as ordinary tiredness. It can appear suddenly. It's both physically and mentally paralyzing and does not improve even after resting. Many people say they can hardly concentrate or manage simple daily tasks anymore. Other common symptoms are shortness of breath and heart palpitations, especially during physical activity. The cause is usually anemia, a shortage of red blood cells. As you learned in clip 1, red blood cells, so-called erythrocytes, transport oxygen with the help of hemoglobin. If these cells do not function, the body lacks the energy it needs. Other common signs is pale skin or pale mucous membranes, sometimes with a yellowish tone. This can be a sign of hemolysis, which means that your own uncontrolled immune system is destroying the red blood cells. In this process, hemoglobin, the red blood cell pigment, is released. Part of it turns into bilirubin, a yellow pigment that builds up when red blood cells are destroyed. Other symptoms may occur as well. These are less common but still burdensome. Concentration problems, abdominal pain, muscle cramps, or headaches. Some patients also report difficulty swallowing or erectile dysfunction. And here's the crucial point. Just because a symptom is not very pronounced for you, that doesn't mean it is harmless. It may signal changes or show that your therapy is no longer working optimally. Talk to your doctor about anything that affects your body and do it right away as soon as you notice something. It is helpful to keep track of your symptoms. For example, with a PNH symptom app. You can note down things like your energy levels, any symptoms or new problems. This makes it easier to spot patterns and your doctor can support you more effectively. Having a PNH diagnosis doesn't mean you will always have serious symptoms. Sometimes that feels mild for you might be difficult for somebody else, and the other way around. That's why it's so important. Keep track of your symptoms, pay attention, and most of all, take action if something changes. Remember, you're not alone. So this was the first season of PNH video series. I hope you found some useful information about your condition. There are still 2 more seasons ahead of you, where we'll cover other key topics of paroxysmal nocturnal hemoglobinuria. Thank you for watching.